So, an introduction to our presentation on HIV. HIV is the abbreviation for human immunodeficiency virus. This was first identified in 1983, and I apologize for the mispronunciation, but by Francois and Dr. Luc Montagnier. And so when it was identified in the 80s and 90s, HIV was highly stigmatized, and those that were infected by HIV and became symptomatic or were known to be HIV positive throughout this time, and even to this day, were discriminated or were stigmatized in their public and in their private lives. The Joint United Nations Program for HIV/AIDS estimated about 39 million people in 2022 to be infected with HIV. And this estimation of people includes, infants all the way to adults. So there is no age group that is necessarily protected or not as impacted. It's pretty even depending on the circumstances and where they are in the world. Currently, there is no cure for HIV, but risks can be mitigated through prevention and treatment, health education and promotion, proper testing, and things of that nature that we'll dive into in our presentation. So the disease agent for HIV, HIV is a type of lentivirus in the family of Retroviridae. The origin of HIV is tracked down to a simian immunodeficiency virus, also abbreviated as SIV, that is found in non-human primates such as chimpanzees, which was more located in West Africa, and the Suti mangabes were seen in Central Africa. And so it was believed that there was some sort of transmission that occurred between, a non-human primate such as these two to humans, but that does not mean that it can be transmitted back from humans to animals. So HIV is normally more of a human-to-human virus. There are two types of HIV. There's HIV-1 and HIV-2. HIV-1 is quicker to progress and turn into acquired immunodeficiency syndrome, and we'll get to that in just a moment. And HIV-2 is slower to progress into AIDS, and there is also a delay of onset of symptoms known for HIV. So HIV is a bit quicker in its progression, and HIV-2 is a bit slower. So for HIV-1 and HIV-2, they do have genetic differences, but their methods of transmission are still the same. So it can be broken up into two categories. One is risky behavior, the other is non-risky behavior. So in risky behavior, it can be seen through unprotected sex, where blood, semen, and other bodily fluids may be shared between partners without the proper use of protection. And that can be from male to female, or male to female. This can also be seen in sharing drug paraphernalia, so that can be needles or syringes that are contaminated with HIV positive blood. And in the non-risky behavior, can be transferred in pregnancy, so from the mother to the infant, in breastfeeding, the same concept, or in organ or blood donations from HIV positive donors. However, this is very unlikely, specifically in the United States, where the blood and the organ is screened vigorously, but there is always a possibility, and a higher possibility in hospitals that don't screen as intensely for HIV. So some symptoms that can be seen with HIV include sore throat, fever, swollen lymph nodes, a rash, mouth ulcers, chills, muscle aches, and fatigue. And these symptoms will kind of come about 2 to 4 weeks after an individual has been exposed. However, there are many individuals that remain asymptomatic even after this 2 to 4 weeks time period. And also, the symptoms don't necessarily need to come in a cluster, as I mentioned, or as I listed them out. They can occur in, 1 or 2 symptoms at a time, or it can be a cluster of symptoms. And so some of these symptoms can be seen with other illnesses. And so if you don't know that you were exposed to an individual that has HIV, then, HIV won't necessarily come to the top of a person's list of things to check out for. unless, if they were exposed to some sort of risky behavior, then that could be, kind of an indication that they may have been exposed to HIV. But again, they could be symptomatic or they could be asymptomatic. It really depends on the individual and the type of HIV that they have as well. So HIV-1 versus HIV-2 can also play a role in that as well. So HIV has 3 different stages to it. The first stage is the acute HIV infection. And this occurs weeks after an individual has been exposed to the infection. And this is where they'll become symptomatic, as I previously mentioned in the symptom slide. And as the virus attacks their immune system, and then over a course of several years, an individual will move into stage 2, which is the chronic HIV infection stage. And this is where the virus continues to attack their immune system. So many times individuals will have, other illnesses going on or be susceptible to infections or other illnesses as their immune system continues to be debilitated. However, in this stage, an individual could also be asymptomatic or can continue to be symptomatic depending on, their treatments and if they're dealing with other illnesses. However, in this stage, if an individual has access to treatments, their HIV levels could be undetectable. And so it just kind of depends on whether they're able to take medications or, kind of be compliant as well. And then after several more years, an individual will go into stage 3, which is the AIDS stage. As HIV continues to progress, it progresses to AIDS. And in this stage, if an individual is not seeking treatment or does not have access to treatment, they will continue to remain highly infectious and the virus will continue attacking their immune system, which will make them incredibly weak and susceptible. And typically a person in this stage will not survive past 3 years. And so it just really depends on whether or not they're able to have access to treatment and how their bodies are responding. But this is the most severe stage of HIV, and this is where that treatment plan comes into place and the accessibility to it as well.
Continuing with prevention, the NIH is funding research on 4 types of long-acting HIV prevention. We got the intravaginal ring, which is an insert, and the implant, which is a device implanted in the body and releases antiretroviral drug over a period of time. We got injectables, which will act as long-acting antiretroviral drug, which is injection to the body, and antibody, which is infused or injected. Prevention and intervention continue. So on this slide, we have more detailed information, a series of prevention in a pipeline format. So we have on the current available the HIV treatment for people living with HIV, male and female condoms, as voluntary male medical circumcision, syringes exchange program, and daily prescriptions, as well as how we talked about previously, newly approved and recommended vaginal ring and long-acting injectables, as well as other factors, another series of developments, the injectables, the pharmaceuticals, and a combination of pharmaceuticals with other preventative measures as vaccines. And in development, again, long-lasting implants, the ring, the vaginal inserts, foams, and other gels, patches that are being currently worked on. And some prevention and intervention statistics. So, which was very interesting. The newer or the younger generations, we can see that on the graph to the far left, we see that only 49% of those ages from 13 through 24 knew of their status, and a lot of it is a lack of information or resources. And following in 2015, 53 babies were born with HIV, and of that, the largest percent being African American, Black, followed by Hispanic and Latino. And then prevention and care outcomes, of those diagnosed, only 86% got services, as well as other cares with 63%, and other viral suppressions. Once they were getting treatment, the suppression rate was at 51%. Continuing with intervention, so we need to have an organized format. So right here, this slide shows a structural intervention taxonomy. First, we have the axis. We have subcategory HIV testing, condoms, your very basic interventional resources, sterile injections, HIV healthcare, followed by a capacity of a building. You have providers, technology, hiring staff, funding, staff incentives. Then we're followed by the community mobilization, a process of change generated within sustainable through community interactions through over time. And then mass media, which is very important nowadays. You have the marketing, the narrative, and this affects people a lot, especially with the newer generation. Falling off with physical structure, you have the integration of services, the new physical structures that are being built, where resources are going, and the service provided in non-traditional settings. And this goes along with what follows with the policy and procedures, which is where the institutions, the policies are put forward, enacted, and this is the government aspect policy, the legislation. And lastly, the social determinants of health would be the subcategorical survival aspect, the acceptance and respect. Continuing with environmental factors. So right here to our left, you can see to the graph, you see how the individual, the HIV, STI awareness, the sexual risk taking, followed by the microsystem, the dyadic, and then the mesosystem, the network, the sex exchange, the community social support, and lastly by the community, the exosystem, the poverty, the prevalence, the gender imbalances. So factors that stood out, the contributing, were the poverty, the cultural, including religion and traditions, discrimination, prevalence of HIV and other STDs in the community, and access to treatment.
Alright, so when looking at prevalence, you can see in the South Africa that a lot of the prevalence is very high when regards to HIV. This study here from 2019 is showing that you can see in the red over here in this area compared to the orangish yellow in South America, and in North America, United States, and Canada, where it's a lot brighter. Now the numbers are still extremely high in regard to HIV cases, and in 2020 and 23 the numbers did continuously rise over time, but even with that, it's still able to show where the most of it is kind of coming from is still within on the African continent, southern portion of it, where you have a higher prevalence rate. So basically, the lighter color is low, but prevalence still high. High prevalence is still high for the red, and then that blue is very much just none whatsoever. That's anywhere where you don't really see anywhere, unless it will be in the poor areas because there is no population over there. So prevalence continued. 20.8 million people with HIV live in South Africa. 39 million people are living with HIV worldwide. The ages from which prevalence is very high is from 15 to 49 years old. You're more likely to catch it or contract the virus in between this age. It is very common. The African region is most affected by HIV in the world, and it continues to spread because of resources, health care, and it kind of runs it. In conclusion, the the immunodeficiency virus takes the lives of around 1 million people, 1 million individuals each year. HIV affects households, communities, and economic growth in countries worldwide. So HIV is something that continues on today and continues to tear down communities, tear down countries, and tear down people's lives if not taken seriously. Now we do have more efficient tools of controlling it, especially here within the United States with modernized drugs that are able to keep it in check and compared to other countries, but it is still something that is in dire need of just reform and assistance in regard to health, because it is destroying these communities and lives, and it affects everyone, not just those that are positive, but everyone is affected by this.